Hi, this is Dr. Kinga Porter from Whole Health, and welcome to our second segment of the series on health and nutrition. Last week we talked about several different diets, and I wanted to update you guys about what I was doing to kind of join you on this journey of 2018 healthy weight loss. So I actually started the Ketogenic Diet. I've been on that for almost 2 weeks now. And as you can all remember, the ketogenic diet has a very, very low carb count. So it means less than 5 to 10% of your total calories coming from carbohydrates. So my personal daily carbohydrate intake has been under 20 grams of net carbs a day, which ends up being pretty difficult. It's been a very interesting journey. For example, I never knew that there were 3 net grams of carbs in a single cucumber. So if you count that, it adds up pretty quickly. I have actually felt some differences since doing this for 2 weeks. I'm feeling much more awake and alert. I feel like I'm not having those sugar crashes throughout the day. I no longer eat lunch and then feel sleepy for a while like most of us used to. I've noticed a little bit of weight loss. But then I didn't have a very high carb intake prior to this diet anyway. I have several patients on this diet right now and have had phenomenal weight loss since starting. I have a certain diabetic patient who has now had perfect blood sugar numbers since starting this diet. So it's working really well for everybody all around. I'm going to plan on continuing this and seeing how it goes. If any of you have comments or questions on your personal journey on the ketogenic diet or any other diet, for that matter, please leave a comment at the bottom of this video and I will respond as quickly as possible. So let's talk about the exercise portion of your weight loss journey. So there are different recommendations for different medical conditions and different recommendations for men and women. One of the biggest differences seems to be that women specifically do very well with interval training. And what interval training means is that instead of getting your heart rate up a little bit and then maintaining it at that lower level, you tend to do that, but then throughout the exercise you get your heart rate up much higher to maximal intensity heart rate for a certain period of time and then back down. Usually what I could recommend is doing about a minute on and then 2 minutes off. So you might want to start with 60 to 70% of your maximal heart rate for 2 minutes, and then going up to about 90% for a minute and then back down to 60-70%. What this does, it actually shocks your body into going into a different metabolic state, and it burns energy much, much faster. Women do tend to respond to interval training better than men do. Men tend to respond well just to getting their heart rates up and then maintaining their heart rates. But women do work a little differently. One of the things I've noticed is that during dietary seasons, women tend to really restrict their calories. And unfortunately, a lot of women will restrict their calories to the point that their body goes into hibernation mode. You do not want to be a hibernating bear. You don't want your body to be so deprived that it wants to store the energy instead of readily burning it during the exercise. I usually recommend not going down below 900 or 1,000 calories for anybody, especially if they're exercising. But there are caloric calculations you can do based on your weight loss goals online, and those will be very patient specific. So if you liked this video, please subscribe to the channel and share it with all your family and friends so that everybody can get more information. If you have any questions, please leave comments at the bottom of the page, and stay tuned till next week when we'll be talking about another weight loss topic.